Have you ever stopped to observe your feet at the end of the day and felt they no longer belong to your body, as if they were heavy, strange, and visibly marked by the seams of your socks? Often we ignore this subtle swelling, treating it as just a passing discomfort caused by the heat or the natural fatigue of someone who has already walked decades through life. However, what seems to be a mere aesthetic detail is, in fact, a silent cry coming from the depths of your circulatory system, a warning sign your body emits to say that something is not right. Ignoring this accumulation of fluid in your ankles is like ignoring a red light flashing on an airplane's dashboard in mid-flight. It is an invisible risk that seriously compromises your autonomy and jeopardizes the vital strength of your main engine, your heart. But what if I told you that this swelling, though concerning, is also a powerful opportunity to regain total control over your aging and longevity? Today, we are going to dive into a discovery that completely changes the perception of aging. Your feet are not just tools for locomotion, but rather the peripheral control panel of your cardiac health. Understanding why fluid stalls in your extremities is the first step toward transforming the fear of fragility into a routine of proactive monitoring and physical vigor. You will learn to read the signs that gravity imprints on your skin, identifying risks of heart failure or thrombosis long before they become an acute and disabling crisis. This knowledge is not just about avoiding diseases, but about ensuring that every step taken from now on is light, firm, and filled with dignity. This swelling phenomenon, technically known as edema, is frequently accepted as an inevitable price to pay for the accumulation of birthdays, but this normalization of decline is a dangerous mistake. Millions of people over 60 live daily with heavy legs and ankles that seem to double in size by evening, believing this is just tiredness or the effect of the weather. However, this passive acceptance masks silent problems that, if ignored, can evolve into serious complications such as chronic venous insufficiency or even the dreaded congestive heart failure. The real danger lies precisely in the fact that swelling does not cause immediate acute pain, acting like a stealthy invader that, little by little, steals agility and overloads the circulatory system without the individual realizing the gravity of the scenario until shortness of breath or immobility becomes an unsustainable crisis. Over the decades, the human body faces inevitable biological changes that alter the way blood circulates from the extremities back to the torso. After the age of 60, our veins lose part of their natural elasticity, becoming less resilient and finding greater difficulty in pushing blood against the constant force of gravity. In addition, we face sarcopenia, which is the loss of muscle mass, especially affecting the calves, which function as our second heart. Without strong musculature to pump blood upward, fluid ends up stalling in the feet and ankles, creating an accumulation that presses against tissues and signals that the body's mechanics are losing efficiency. It is a multifactorial challenge where basic biology begins to work against the fluidity necessary to maintain the vitality and energy that an active life demands from us all. Compounding these vascular changes, renal function also tends to become less efficient at filtering sodium, which favors systemic fluid retention more aggressively in maturity. At the same time, the heart may present ventricular stiffness, requiring a much greater effort to relax and fill with blood properly with each beat. This reflux of pressure ends up manifesting at the far end in your feet as an overflow of a system that can no longer manage fluid volume with the same precision as in youth. Understanding that swelling is not an isolated event, but the result of a complex interplay involving kidneys, muscles, and the cardiac muscle is essential for anyone who wishes to age with lucidity and autonomy. Monitoring these extremities is the key to ensuring that your internal hydraulic system continues to operate within a safe margin of health. The great conflict we face in maturity is not just aging itself, but the dangerous normalization of physical decline that occurs in a sneaky and silent way. Many of us were taught to believe that heavy legs at the end of the day or deep sock marks on the ankles are just age-related things, an acceptable discomfort that is part of the natural process of getting older. However, this is the fundamental error that sabotages longevity. After age 60, the human body drastically loses its margin of error for circulatory neglect. What begins as occasional swelling may, in fact, be hiding early-stage congestive heart failure or a severe failure in venous return. By ignoring this control panel on your feet, you are allowing a simple mechanical problem to turn into a systemic crisis where your heart is forced to work in constant overload without any relief. What is truly at stake here goes far beyond simple swelling. It is about maintaining your autonomy, your mobility, and your ability to live without depending on others. When your feet remain swollen, your legs become heavy, turning pleasant walks into exhausting burdens that drastically reduce your daily physical activity level. This reduction in movement triggers a catastrophic domino effect, accelerating muscle mass loss and exponentially increasing the risk of serious falls and fractures that change lives forever. Furthermore, the cardiac overload signaled by persistent edema compromises cerebral oxygenation, affecting your mental clarity and increasing the risk of prolonged hospitalizations, which are the main factor in the loss of independence in old age. Keeping your feet dry and monitored is therefore the most strategic defense to ensure you remain the master of your own movement and destiny. The first fundamental pillar for understanding this dynamic is the biology of gravity acting on a body that has already traversed 6 decades of movement. Imagine your circulatory system as a complex network of pipes in a multi-story building where the heart is the main pump located in the center of the structure. With advancing age, the walls of your veins become less elastic, losing the contractile capacity necessary to overcome the constant force that pulls everything toward the ground. When we spend too much time sitting or standing, hydrostatic pressure increases considerably in the lower extremities, causing blood plasma to cross the vessel walls and accumulate in the tissues around the ankles. This stalling of fluids is not just a mechanical failure, but a clear sign that your return system is struggling against basic physics without adequate support from your vascular biology. It is crucial to discern that not all swelling has the same origin, and knowing how to differentiate between venous, lymphatic, and cardiac edema is the key to your power of prevention. Swelling of venous origin is usually more evident at the end of the day, improving significantly after a night of rest with elevated legs, while lymphatic edema tends to be harder and more persistent. However, the most concerning sign for your longevity is bilateral and symmetrical swelling that affects both feet simultaneously, suggesting that the problem is not just located in the legs, but in the central pump's ability to manage total blood volume. Ignoring this distinction is like trying to fix a leak in the roof when the problem is in the house's foundations. Recognizing the nature of the accumulated fluid allows you to direct your actions towards strengthening the heart or improving the drainage of your veins strategically and consciously. To identify if your swelling is a sign of systemic fluid retention, you must master a simple yet powerful technique called the pitting test or Godet's sign. This technical procedure consists of applying firm and constant pressure with your thumb over the bony region of the ankle, just above the malleolus, for about 5 to 10 seconds. Upon removing your finger, you must carefully observe whether the skin immediately returns to its original position or if a depression remains, a small hole at the spot where you pressed. If your finger mark persists for several seconds before disappearing, this is irrefutable visual proof that there is fluid accumulated in the interstitial space, indicating that your circulatory system is operating above its drainage capacity and that your body is retaining dangerous volumes of fluids. If you perform this test just now, or if you usually notice these deep pressure marks on your skin, know that you are not alone in this journey of care and self-discovery. Realizing that your body is communicating with you is a step of extreme wisdom, and I would like to congratulate you for dedicating this time to understanding the signs of your own health. If this knowledge is bringing clarity to what you feel daily, tell me in the comments. Have you ever noticed these deep marks when taking off your socks or after a long day of sitting? Sharing your experience helps others to stay alert as well. And if you wish to continue receiving safe guidance on how to keep your heart strong and your autonomy preserved after 60, subscribe to the channel to join our community focused on longevity and active power. The third pillar of this script reveals the direct and intimate connection between your heart and your ankle, specifically focused on the functioning of the right ventricle. When the right side of the heart begins to lose its contractile strength, it cannot efficiently pump the blood coming from the veins toward the lungs to be oxygenated. This deficit creates a reflux or congestion effect where pressure in the systemic veins increases, forcing fluid to escape into the tissues, manifesting first in the lowest areas of the body due to gravity. Therefore, a swollen ankle can be the first indicator that your right ventricle is under stress, trying to compensate for a failure that has not yet manifested as shortness of breath. Monitoring the volume of your feet is, in practice, monitoring the vigor and resilience of the cardiac muscle that sustains your entire biological life. Another fundamental turning point in your daily observation is understanding the difference between unilateral and bilateral swelling, as this defines the urgency of your action. If only one foot or leg is swollen, accompanied by pain, heat, or redness in the calf, the alert changes completely. It could be deep vein thrombosis, an emergency condition that requires immediate medical attention to avoid an embolism. On the other hand, swelling that appears in both feet simultaneously points to systemic causes such as the heart or kidneys, indicating a need for lifestyle and medication adjustments. Having the clarity to distinguish a localized problem from a central failure is what separates the vulnerable elder from the empowered elder, who knows exactly when to seek help and when to make adjustments in their own maintenance routine. We now enter the territory of the hidden enemy that inhabits many kitchens: excess sodium and the consumption of ultra-processed foods that silently sabotage your vascular health. Sodium possesses a chemical property of attracting and retaining water inside the blood vessels, drastically increasing the volume of blood that your heart needs to pump every minute. For a person over 60 whose renal system no longer filters excess with the same speed as before, a single salt-rich meal can result in pounds of fluid retention distributed through the legs in the following hours. This excess fluid creates volumetric hypertension that punishes vein valves and dilates cardiac cavities. Reducing salt and industrialized seasonings is not just a dietary choice, but a direct mechanical intervention to relieve the load on your heart and dry out your ankles. Besides diet, we need to talk about medication sabotage that often occurs through self-medication or chronic use of common anti-inflammatories. Many seniors frequently resort to pills for joint pain without knowing that these substances harm renal function and cause sodium and water retention as a direct side effect. This indiscriminate use creates a vicious cycle where the medication relieves knee pain but causes severe swelling in the feet, which in turn overloads the cardiovascular system. Some blood pressure medications can also cause edema as a secondary effect, which requires a careful review with your trusted doctor. Power in old age comes from technical knowledge about what enters your body, ensuring that the treatment of a symptom does not become the cause of a much more serious and disabling heart problem. To regain your circulatory power, you need to activate what science calls the second heart, your calf muscles. Unlike arteries, which have the heart to propel blood, veins depend almost entirely on muscle compression to push blood back up. As we age and become more sedentary, this muscle pump weakens due to sarcopenia, allowing blood to remain stagnant in the lower limbs. By strengthening the calves, you create efficient mechanical pressure that squeezes the veins with every step, ensuring the fluid doesn't have time to leak into the tissues. An older adult with active and strong calves has a much more potent natural drainage system, protecting the central heart from having to do all the work alone and ensuring light legs for much longer. The practical applicability of this activation is simple and can be incorporated even while you are watching this video or resting in your favorite armchair. The plantar flexion exercise, which consists of raising the heels while keeping the balls of the feet on the ground, is a tool of immediate power to reactivate your venous return. Performing small sets of this movement several times a day forces blood to circulate, reducing stagnant pressure in the ankles and preventing the formation of chronic edema. Imagine that every up and down movement of your feet is an extra pulse you offer to your circulatory system, relieving the effort of your heart and clearing the paths of your vitality. Integrating this practice into your daily routine transforms the act of sitting into a moment of active vascular physical therapy, keeping the corporal gears always lubricated and functional. Finally, we must adjust your daily postural hygiene to ensure that rest works in favor of your longevity, not against it. Elevating your legs correctly, positioning the ankles above heart level for at least 20 minutes twice a day, utilizes gravity itself to drain the excess accumulated fluid. However, avoid excessively bending the knees or using cushions that constrict circulation behind the thighs, as this can interrupt blood flow instead of helping it. By adopting this conscious drainage posture, you allow your lymphatic and venous system to recover from daily exertion, returning fluid volume to the central circulation where it can be filtered by the kidneys and eliminated. Small adjustments in how you rest can mean the difference between waking up with light legs ready for life or carrying the weight of chronic fatigue. Think of the story of Mr. Antonio, who at 65 began to notice his shoes felt tight at the end of the day, but decided to ignore the sign, attributing it to the fatigue of long walks. Over the months, the swelling rising up his ankles turned into disabling shortness of breath during the night, resulting in an emergency hospitalization for pulmonary edema that robbed him of months of autonomy. In contrast, we have the example of Mrs. Maria, who, upon noticing the first deep sock mark on her skin, did not hesitate to seek help and adjust her salt intake and exercise routine. Today, at 70, she enjoys light legs and a heart that beats with vigor, proving that the difference between dependence and vitality lies in the courage to observe the signs and act before the body loses its margin of safety. The human body does not age randomly or in a disordered way. It follows a precise biological logic that reflects every choice made over the decades. Often we view decline as something sudden, a stroke of fate that hits us without warning. But the reality is that aging is a progressive and silent process where small habits accumulate monumental impacts. The swelling you see today in your feet is the final result of years of your circulatory system adapting to constant pressures and invisible wear and tear. Understanding that your body is a machine of cause and effect allows you to stop being a passive spectator of time, to become the architect of your own vitality. Every decision to move, every food choice, and every moment of attention to physical signs are investments that protect your autonomy and ensure that old age is a prosperous period. It is natural to feel apprehensive when realizing that the body is not invulnerable and that the heart may be calling for help through signs like a swollen ankle. This fear is legitimate and serves as fuel for your vigilance. But the invitation here is to action, as human biology remains resilient after 60 years of life. I recognize your effort in seeking quality information, and for this reason, I ask that you share this video with family members who need this vital alert right now. There is still plenty of time to reverse fluid retention and relieve the cardiac load with simple adjustments to your daily routine. Old age should not be an inevitable decline, but a phase of strengthening where knowledge transforms fear into the power to live fully, ensuring that everyone around you maintains vitality and independence for much longer. If you choose to ignore the accumulation of fluids and the stiffness in your legs, the implications for your future will be severe and often irreversible. Persistent swelling is the first step toward sharp physical decline, as poor circulation reduces tissue oxygenation and overloads the cardiac muscle to the limit of exhaustion. Without intervention, the loss of mobility becomes an insurmountable barrier, leading to family dependence and frequent hospitalizations for respiratory crises or wounds that are difficult to heal. On the other hand, the scenario for those who act preventively is one of total contrast and preserved autonomy. By monitoring your feet and activating your circulation, you maintain your ability to walk with lightness and ensure the heart operates in a vital safety zone. The choice between an old age of limitations or a life of freedom lies in the health of your feet. One of the most counterintuitive points about swelling in maturity is the paradoxical relationship between hydration and fluid retention. Many people make the strategic mistake of drastically reducing water intake when they notice their feet are heavy, believing that less fluid in the body will result in less volume in the legs. However, when you deprive your body of water, the brain activates survival hormonal mechanisms that order the maximum retention of sodium in fluids, severely worsening the circulatory problem. Another surprising revelation is that the disappearance of swelling in the morning does not necessarily mean the cardiac cause was resolved. It merely indicates that the fluid was redistributed to the torso during horizontal rest. Understanding that the body may be hiding excess volume in other organs is a game changer for anyone seeking to monitor heart health with absolute precision and full bodily autonomy. For this knowledge to become a tool of immediate power, I invite you to establish a daily ritual of conscious observation of your own body before sleeping. When you take off your shoes and socks, do not view your feet as merely tired extremities, but as messengers of your internal cardiovascular health. Perform the pressure test we taught and observe if the skin takes time to return to normal. If you notice any sign of retention, start today by reducing the hidden salt in processed foods and replace them with natural seasonings. Integrate calf movements into mundane moments, such as while brushing your teeth or waiting for coffee, transforming those seconds into strengthening sessions for your second heart. Small changes in routine, like avoiding crossing your legs and ensuring constant hydration, combined with everything you have learned today, are the fundamental adjustments to protect your heart and debloat your feet. Leave your reflection in the comments, subscribe to strengthen your longevity with us, and share this video with those you love so that everyone ages with the vigor and dignity they deserve.